We want you to be as informed as possible about COVID-19, and that's why we're taking your questions to the experts. Tonight, I FaceTime with Dr. Cindy Smith, co-CEO of Caris Health in Wilmer. Okay, let's get started with our first question. Dr. Smith, the Minnesota Department of Health has said we're starting to climb towards our curve, over our curve here in Minnesota. So do you think our hospital system is ready for this spike in cases we're about to experience?
I do. Based on what the task force at the statewide level and based on our experience out here, we do think we're ready for the surge and the peak when it comes. We've had the advantage of having the last month to prepare, and it's been a real blessing for the state of Minnesota, and we think we're ready.
Specifically, where you live and where you work, do you have any concerns being in a rural community? How is your hospital's PPE and testing supply out there?
So we, as Caris Health, is part of CentraCare, and we have worked with CentraCare and with all the regional and critical access hospitals to prepare together. We think we're as prepared as we can be. As we've looked at our PPE supplies, which we just looked at Friday, we're in pretty good shape. Most recently, one of the struggles we've had is with testing swabs, but that's been kind of an issue throughout the entire state. So we have a dashboard that tells us whether we're in the green, the yellow, or the red from a testing supply standpoint, and that tells us if we've got 2-week supplies or if we've got 4-week supplies of PPE and a variety of things, and we're in relatively good shape with our supplies right now.
As our weather gets nicer, warmer, Minnesotans may struggle to stay at home, which they're allowed to go out. But what would you say to folks who may begin to let their guards down when it comes to social distancing?
So I would really encourage people not to let your guard down. The virus is spiking in Minnesota right now, not going away. And so our risk is going up, not down. We certainly understand that people want to get back to normal and we want to go outside. The weather is getting nicer. But when you go outside, still consider your risk of catching the virus. So keep 6 to 10 feet away from people. Stay away from large groups. Hopefully we don't have large groups coming together. Be sure and wear that social mask, which helps protect you from others to some extent, but even more so protects you from spreading potential virus to others. And most importantly, just wash your hands. Remember that the COVID-19 virus is spread via droplet spread, and so it can be on multiple different surfaces that you touch. And if you touch the surface and you touch your eyes or your mouth or your nose, then you can catch the virus in that way. So you just want to avoid touching surfaces and make sure that you wash your hands frequently.
The list of symptoms of COVID-19 recently got longer. So if you're feeling sick, what should someone do?
If you're feeling sick, you should contact your local health services. For us, for example, we have a nurse call line that people should call in. So it kind of depends on where you live and who your local healthcare provider or physician is. And so you should call whoever your local services are.
Let's transition now to viewer questions. Kim is wondering, do homemade masks help spread the virus?
So we think that homemade masks help reduce the spread of the virus. All right. If you're wearing a mask, you can avoid spreading the virus to other people. Now, if you're not thinking carefully and you contaminate the mask, for instance, with your fingers, that could potentially increase your risk of catching the virus from your mask. So you really want to be thoughtful with the mask that you're wearing. Avoid touching things and touching the mask and touching your face, and make sure that you wash the mask frequently.
Rachel wants to know, if someone is asymptomatic and they happen to test positive, do they ever begin to show symptoms?
So that's the funny thing about this virus. It's so different for so many people. Some people catch it and they develop really severe symptoms and can die. Some people have the virus and don't have any symptoms at all. So that's what's been very frustrating and very variable from person to person. Even if you have no symptoms and you have the virus, you can still spread it. And that's why the virus has been so successful at spreading from person to person.
Allie is wondering, when will we be able to hug our friends again? She says she can't wait 2 years to do that.
Yeah, Allie, I really sympathize with you. I have a grandbaby in California that I would love to see and I would love to hug. She's right. It's going to be a couple years before we're back to normal. So we'll just have to play it by ear and decide when we think it's safe from an exposure standpoint. And we're not exactly sure when that's going to be. But I would think very carefully about who you want to hug. For instance, I don't want to hug my granddaughter right now, because if I was an asymptomatic carrier and I hugged my granddaughter and gave the virus to her, I would feel horrible about that. So as much as I want to hug her and hug my friends, I'm loving them by not hugging them right now, as hard as it is.
Do you have any questions about COVID-19? We're doing our best to find the answers, and you can send your questions to tips@WCCO.org.